You were told to take the pill, but not what it could do to your body. Blood pressure meds are everywhere, and millions take them daily. But what most people don't know is that these pills aren't one size fits all, and they come with hidden side effects, long-term risks, and often zero explanation. In this video, we're breaking down what your doctor didn't tell you about blood pressure medication, from how they work, to why you might still have high BP, to whether you can ever stop taking them safely. This isn't anti-medicine, it's pro-awareness. Because if you're going to take a pill every day for the rest of your life, you deserve to know everything about it. Let's start with the first truth. Not all blood pressure meds work the same, and some may not work for you at all. 1. Not all BP medications work the same way. If you think all blood pressure pills do the same thing, think again. Your medication may be working on your heart, your kidneys, or your blood vessels, and knowing which can make all the difference. Most people are surprised to learn that there are several different types of blood pressure medications, and each class works in a completely different way. Some reduce fluid, others relax your arteries, and some slow your heartbeat. If your doctor didn't explain which one you're taking and why, you might be missing out on a better or safer option. The main types of blood pressure medications. Here's a breakdown of the most common types and what they do. 1. Diuretics, water pills. How they work. Help your kidneys remove excess salt and water from your body, lowering blood volume and pressure. Common meds, hydrochlorothiazide, chlorthalidone. Possible side effects, frequent urination, dehydration, low potassium, muscle cramps. What doctors don't always say, these are often the first-line treatment, but if you're getting up to pee multiple times at night or feeling weak, your dose may be too high. 2. ACE inhibitors and ARBs. How they work. Relax your blood vessels by blocking hormones that cause them to tighten. Common meds, ACE inhibitors, lisinopril, enalapril. ARBs, losartan, valsartan. Possible side effects, persistent dry cough, ACE inhibitors. Dizziness, elevated potassium, kidney issues in some patients. What doctors don't always say, ACE inhibitors often cause a dry cough. If that happens, an ARB might be a better alternative, but you need to ask. 3. Calcium channel blockers. How they work. Prevent calcium from entering heart and blood vessel cells, helping them relax. Common meds, amlodipine, diltiazem, verapamil. Possible side effects, swollen ankles, constipation, fatigue, headache. What doctors don't always say, swelling is very common with these. Many patients switch meds thinking something's wrong when it's actually a known side effect. 4. Beta blockers. How they work. Slow down your heart rate and reduce the force of each beat. Common meds, metoprolol, atenolol, propranolol. Possible side effects, fatigue, cold hands and feet, depression, sexual side effects. What doctors don't always say, these are no longer first-line meds for most people with high blood pressure, unless you've had a heart attack or specific heart conditions. So why does it matter? Because your body might respond better to one class than another. If you've been taking meds but your BP isn't budging, or you're feeling side effects, you may simply be on the wrong type. Unfortunately, doctors are often rushed, and many patients don't know they have options. But you do. What you should ask your doctor. What type of BP medication am I on and why? Is this the best choice for my age and health conditions? If I'm having side effects, are there safer alternatives? Could we try a different class of medication? Understanding the mechanism of your meds gives you power, not to reject them, but to work with your doctor more effectively and avoid unnecessary trial and error. 2. Side effects you might not be warned about. Your blood pressure might go down, but what else is your medication doing to your body? Most doctors mention the common side effects when they prescribe blood pressure meds, but many patients still walk away unaware of how these pills might affect their energy, mood, sex life, or even long-term health. Some effects are brushed off as normal. Others are never discussed unless you bring them up. But make no mistake, they matter. Let's go through some of the most common, overlooked, and under-discussed side effects of blood pressure medications and what you can do about them. 1. Fatigue and low energy. Many BP meds, especially beta blockers and diuretics, can leave you feeling tired, sluggish, or just off. You might think you're aging or depressed, but the real culprit could be the medication. Why it happens: slower heart rate, lower blood volume, electrolyte imbalances. What to do? Don't accept chronic fatigue as normal. Ask your doctor about adjusting your dosage or switching to a different class of medication. 2. Sexual dysfunction. This one is rarely mentioned, but it's very real. Some blood pressure medications, especially beta blockers and diuretics, can cause erectile dysfunction in men, reduced libido in both men and women, difficulty reaching orgasm. Why it happens: reduced blood flow and changes in hormone levels. What to do? Tell your doctor. There are BP meds with fewer sexual side effects, but you won't know unless you ask. 3. Mood changes and depression. Some medications, again, especially beta blockers, can affect your mood and mental clarity. People report feeling emotionally flat, sad, or disconnected. Why it happens: these meds can affect your central nervous system and reduce adrenaline. While helpful for the heart, it can dull your energy and emotions. What to do? Discuss switching to a different type of BP medication if you notice mood changes that weren't there before. 4. Swelling and fluid retention. Calcium channel blockers like amlodipine are notorious for causing ankle swelling and water retention. This can be uncomfortable and, in some cases, mistaken for heart or kidney issues. What to do? Swelling doesn't always mean the med is harming you, but it's a red flag that should be addressed. A simple medication switch often solves the issue. 5. Cough or throat irritation. If you're on an ACE inhibitor like lisinopril and you're dealing with a chronic dry cough, it's likely not allergies or a cold, it's the medication. What to do? Switching to an ARB like losartan or valsartan usually eliminates the cough without affecting blood pressure control. 6. Electrolyte imbalances. Diuretics can lower potassium, magnesium, and sodium levels. This might cause muscle cramps, irregular heartbeat, mental fog, weakness. What to do? Ask your doctor to regularly check your electrolyte levels and adjust supplements or medications as needed. 7. Cold extremities or Raynaud's syndrome. Cold hands and feet, tingling or color changes in fingers. This can be a side effect of beta blockers reducing circulation. What to do? Report it. It may not be dangerous, but it's something your doctor can easily adjust for. Don't suffer in silence. Many people live with these symptoms for months or even years, thinking it's just something they have to tolerate. But in many cases, a simple medication change can dramatically improve your quality of life. Your doctor may not bring up every side effect, but that doesn't mean they don't care. They rely on you to speak up. What you should ask is, what I'm feeling normal for this medication? Could this symptom be a side effect of my BP meds? Are there better options with fewer side effects? You deserve to feel well, not just have lower numbers on a monitor. 3. Why you might still have high blood pressure, even while taking pills. You're taking your pills every day, but your numbers are still high. What gives? It's frustrating and common. Many people assume that once they're on medication, their blood pressure will magically normalize. But for millions, that doesn't happen. So if you've been wondering, why is my BP still high even with medication? You're not alone, and the answer might surprise you. Let's break down the reasons behind medication-resistant high blood pressure and what you can do about it. 1. You might have resistant hypertension. This refers to blood pressure that stays high despite being on 3 or more medications, including a diuretic. What causes it? Undiagnosed conditions like sleep apnea, kidney disease, or hormonal disorders. Secondary hypertension from medications like nonsteroidal anti-inflammatory drugs, steroids, or birth control. Poor lifestyle habits like too much salt, alcohol, or stress. What to do? Ask your doctor about testing for secondary causes and reviewing your current medication mix. 2. You may be taking the wrong combination. Some people respond well to one class of medication, but not another. Or they may need 2 or 3 types working together for full control. Example, a diuretic might lower fluid volume, but if your blood vessels are still too tight, you'll need a vasodilator too. What to do? Ask your doctor. Are we using the right combination of meds? Should we be adding or adjusting one of them based on my readings? 3. You're not measuring correctly at home. Let's be honest, many high home readings come from poor technique. Talking or moving during the reading, measuring right after stress or exercise, using the wrong cuff size, not resting for 5 minutes beforehand. All of these can falsely elevate your numbers. What to do? Master your home monitoring habits, and always bring a log of consistent readings taken at the right times to your doctor visits. 4. Your lifestyle is undermining the medication. Even the best pill can't compete with a high-salt diet, no exercise, poor sleep, or constant stress. Some people use medication as a safety net and let their habits slip. But without a healthy foundation, your meds are only doing half the job. What to do? Focus on the fundamentals. Reduce sodium and ultra-processed foods. Increase potassium-rich fruits and vegetables. Get at least 30 minutes of movement daily. Sleep 7 to 8 hours and manage stress. Medication helps, but lifestyle heals. 5. Your dosage or timing may be off. Sometimes your body metabolizes a drug too quickly or too slowly, or taking it at the wrong time of day means it's wearing off too soon. Example, if your BP spikes in the morning, but your meds are taken at night, you may have a coverage gap. What to do? Talk to your doctor about 24-hour monitoring to identify patterns, adjusting the timing or splitting doses, switching to long-acting formulations. 6. You might not be absorbing it properly. Certain conditions like digestive issues or even interactions with food and supplements can block your body from absorbing BP meds efficiently. What to do? Ask your doctor or pharmacist, should I take this with food or on an empty stomach? Are any of my other meds or supplements interfering with absorption? If your blood pressure is still high even on meds, don't assume you're doing something wrong or that the condition is unbeatable. It's often a matter of refining the approach, adjusting the strategy, and staying committed to both medical and lifestyle solutions. 4. What happens if you suddenly stop taking your blood pressure medication? Thinking of skipping your pills for a few days or quitting them altogether? Before you do, know this. Suddenly stopping blood pressure medication can be more dangerous than high blood pressure itself. Many people get frustrated with side effects, feel fine, or just forget their meds and decide to stop cold turkey. But doing so without medical supervision can lead to dangerous spikes, serious complications, or even hospitalization. Let's explore exactly what happens when you suddenly stop taking your BP meds and how to do it safely if needed. What happens when you stop taking BP medication suddenly? Blood pressure medication doesn't just lower your numbers, it trains your body to operate under certain conditions. Removing that support abruptly can trigger a strong rebound effect, causing your blood pressure to shoot up. Here's what can happen. 1. Rebound hypertension. Your BP may become higher than before you started treatment. Why? Your body was used to the medication's effects. Without it, blood vessels constrict rapidly, and your heart works harder. This can happen within 24 to 48 hours of stopping certain meds, especially beta blockers or clonidine. 2. Increased risk of heart attack or stroke. High BP is already a silent risk factor. When it spikes suddenly, it puts extreme pressure on arteries, especially in the heart and brain. Stopping medication without a taper can trigger chest pain, irregular heartbeat, stroke, heart attack. 3. Withdrawal symptoms. Some meds, like beta blockers, cause withdrawal-like symptoms when stopped abruptly. Shakiness, anxiety, palpitations, headaches, shortness of breath. These aren't just uncomfortable, they can mimic or trigger real cardiovascular events. Why people stop and why it's a problem. Most people don't stop their meds out of rebellion. They stop because they feel fine and think they're cured. Side effects are bothering them. They forgot and think it's no big deal. They ran out of pills and delayed refilling. They want to try natural methods instead. But stopping on your own can undo months or years of progress. Even missing a few days can cause your BP to rise gradually or spike without warning. How to stop medication safely, if that's the goal. The good news, you can stop or reduce your meds, but only the right way, with your doctor's guidance. Here's how to do it safely. Step 1, talk to your doctor. Be honest. Let them know why you want to stop, whether it's side effects, cost, or personal preference. Then ask, is my blood pressure controlled enough to reduce or stop medication? What lifestyle goals would I need to meet first? Can we reduce the dose gradually? Step 2, make lifestyle changes. First, before stopping medication, make sure you've built a strong foundation with regular exercise, low-sodium diet, healthy weight, stress management, limited alcohol and no smoking. If your BP is in the normal range consistently for 3 to 6 months, some doctors may support tapering off. Step 3, taper slowly. Never go from full dose to zero overnight. Your doctor may cut your dose in half, switch to a milder medication, alternate days before stopping completely. This prevents rebound hypertension and gives your body time to adjust. Step 4, monitor closely. You'll need to check your BP daily at home. Watch for symptoms like headaches, dizziness, or chest pain. Report any sudden spikes immediately. This isn't a set it and forget it process. It requires patience, precision, and supervision. You're in charge of your health, but stopping blood pressure meds without a plan is risky and potentially life-threatening. If you want to get off medication, the right way is to work with your doctor, not against them. With the right changes and close monitoring, it may be possible, but never do it alone. 5. Can you ever safely get off blood pressure medication? What if you could lower your blood pressure and keep it down without a single pill? It's the question every patient asks at some point. Can I ever stop taking blood pressure medication for good? The short answer, yes, but only under the right conditions and with your doctor's help. Let's break down when and how it's possible to come off BP meds safely and what it really takes to stay off them long term. Yes, it's possible, but not for everyone. Blood pressure medication isn't always a lifelong sentence. In many cases, especially when diagnosed early, lifestyle changes can be so effective that medication becomes unnecessary. But it depends on several key factors: how high your blood pressure was to begin with, how long you've had hypertension, whether there's organ damage, like kidney or heart issues, your age, genetics, and overall health, how committed you are to lifestyle changes. If your BP is only mildly elevated and you're otherwise healthy, your chances of getting off meds are higher. If you've had uncontrolled hypertension for years or developed complications, you may need long-term medication, but can still work on reducing your dosage and improving overall control. What science says about getting off BP meds. Clinical studies have shown that 30 to 40% of people with mild hypertension can successfully discontinue medication after adopting intensive lifestyle changes. In one trial, patients who lost weight, reduced salt, and exercised regularly were able to normalize BP within 3 to 6 months and maintain it without meds under supervision. That said, relapse is common if habits slip, so consistency is key. Signs you might be ready to taper off. Ask your doctor if these apply to you. Your BP has been in the normal range for 3 to 6 months straight. You've made major lifestyle improvements: diet, exercise, weight loss, stress reduction. You're not on multiple medications. You've had no recent spikes or complications. If yes, you may be a candidate for medication tapering or reduction. Lifestyle factors that make it more likely. Here's what helps you safely and sustainably lower blood pressure without meds. Diet or plant-focused eating, reduce sodium less than 1,500 milligrams per day. High potassium, magnesium, fiber. Physical activity. At least 150 minutes per week of moderate aerobic exercise. Strength training 2 times a week. Stress management. Deep breathing, yoga, meditation, prioritizing sleep, 7 to 8 hours per night, limiting alcohol and quitting smoking. Weight loss. Losing just 5 to 10% of body weight can drop systolic BP by 5 to 10 points. What to expect if you taper. Getting off meds isn't instant. Your doctor may reduce your dosage slowly over weeks, switch you to a lower impact medication first, monitor your home readings regularly, schedule more frequent check-ins during the transition. Important, if your BP rises again, it doesn't mean you failed. It just means your body may need longer, or a combination of approaches. The goal is always control, not just avoiding medication. Can you get off BP medication? Yes, for many it's absolutely possible, but it takes more than hope. It takes a proven plan, a partnership with your doctor, real consistent lifestyle change, and if you can't come off them completely, reducing your dose, minimizing side effects, and living a healthy, active life while staying safe is still a huge win. Now let's wrap it all up with the final conclusion. Your blood pressure pill isn't the full story. It's just the beginning. Now you know what most people don't. Not all blood pressure medications work the same way. Side effects are real and manageable. Meds aren't magic. They need support from lifestyle changes. Stopping suddenly is dangerous, but stepping down safely is possible. And yes, with the right plan, you might not need them forever. But none of this happens unless you take control of your treatment. Don't be afraid to ask your doctor the hard questions. Is this the best medication for me? What are the long-term effects? Can I try reducing or stopping with your guidance? The truth is, most doctors want you to succeed, but they're often pressed for time. That's why being informed makes you a better patient and a stronger partner in your own health. So here's your next step. Track your blood pressure at home accurately and consistently. Commit to real lifestyle changes, not just temporary fixes. Work with your doctor, not against them. And above all, remember, you are not powerless. Lowering your blood pressure is possible. Living without meds may be possible. But even if you stay on medication, knowing the full picture puts you in charge. If you found this video helpful, please give it a thumbs up, share it with someone who needs to hear this, and hit that subscribe button for more doctor-backed insights. Because better health starts with better questions.